In our fourth video on endocrinology, we'll look at the posterior pituitary secretions ADH, antidiuretic hormone, and oxytocin. For a review of the interactions between the hypothalamus and the pituitary, please see Endocrine Lecture 3. The hypothalamus lies deep in the brain along the walls and floor of the third ventricle. The hypothalamus communicates closely with the body and with higher brain centers. After gathering information, the hypothalamus sends instructions to the pituitary, both the anterior pituitary and the posterior pituitary. Today, we will be looking at two hormones made in the hypothalamus and controlled and released from the posterior pituitary by signals from the hypothalamus. We'll look at ADH to begin with, antidiuretic hormone. Antidiuretic hormone is also called arginine vasopressin. Made in the hypothalamus, secreted along nerve axons, stored in the pituitary, and released when signals from the hypothalamus are sent to the posterior pituitary. Antidiuretic hormone stimulates the body to hold on to water. This mnemonic may help you remember that. Before we get too much further into how antidiuretic hormone works, we need to say a few things about osmolarity. Osmolarity can be difficult for students to understand. It's much simpler to think of saltiness. Osmolarity and saltiness, they're not exactly the same thing, but pretty close. So think about a beaker of salt water. If you add salt to the beaker, of course it would get saltier. And if you add water to the beaker, it would get less salty. So now substitute the word osmolarity in for saltiness. If you add solute to the solution, the osmolarity increases. If you add water to the solution, the osmolarity decreases. What do you think would happen if you just let the water evaporate? What would happen to the osmolarity if water evaporated from this salt solution? If you've understood these concepts and you remember that antidiuretic hormone adds water, you'll be well on your way to understanding the subtleties of antidiuretic hormone secretion. Consider this problem. If the body's osmolarity is high, what happens to the antidiuretic hormone secretion? Take a moment and rephrase the question in terms of saltiness, and then remember that ADH adds water. Pause the video and work this out for yourself. If you answered that ADH secretion goes up, congratulations. If your osmolarity is too high, then you're too salty, and if you're too salty, you need to add water, and that's what ADH does. So let's think about how that actually works. How does ADH add water to the body? Well, it works in two ways. It works on the kidney to increase the reabsorption of water. So rather than excreting the water in the urine, it pulls the water back. So instead of excreting a dilute urine with lots of water, you excrete a concentrated urine and you bring the water back into the body. Antidiuretic hormone also gives you a dry mouth and stimulates thirst. So it adds water in two ways, by reclaiming water from the kidney and by inducing you to drink. So you can look at this conceptually in this way. If your osmolarity is too high, in other words, if you're too salty, the cells in the hypothalamus recognize a situation and they send a nerve impulse to the posterior pituitary to secrete antidiuretic hormone. Antidiuretic hormone, as we've seen, adds water. It increases the water content of the body, both by reclaiming water from the kidney, and it also makes you thirsty. It dries the mouth and increases your thirst. And so you pull water back into the body, your body gets less salty, the osmolarity goes down, and due to negative feedback, further secretion of antidiuretic hormone is inhibited. Now, antidiuretic hormone has another effect, It causes vasoconstriction. Remember that other name, arginine, vasopressin? Does that word vasopressin help you to figure out what's going on? Vaso for blood vessel, and pressin is something that increases blood pressure. Now, when vasoconstriction occurs, arginine, vasopressin, antidiuretic hormone, causes the smooth muscles in blood vessels to constrict. When that occurs, the blood pressure goes up. Now, whether antidiuretic hormone has an effect in a normal person with normal blood volume and normal blood pressure in maintaining blood pressure seems to be somewhat controversial, but it's certainly the case that when the blood volume is low and the blood pressure is low, antidiuretic hormone is secreted and it causes vasoconstriction. And of course, it also pulls water back into the body. Let's do a little check here and see if you're understanding what's going on. What would happen to the osmolarity of your body if you started with normal osmolarity and then you drank 2 liters of water? And what might you expect to happen to the antidiuretic hormone secretion as a result? Pause the video and think this question through. Well, what would happen to the osmolarity of your body if you started with normal osmolarity and then drank 2 liters of water? Well, what would happen if you had the normal amount of salt in your body and then you drank 2 liters of water? You'd get less salty, wouldn't you? Sure. And so this activity, drinking 2 liters of water, would decrease the osmolarity of the body. And what would happen to antidiuretic hormone secretion as a result? Well, you have too much water. You've added 2 liters of water. You're not salty enough. Do you want to add more water? No, of course you don't. An antidiuretic hormone adds water, so the antidiuretic hormone secretion would go down. Now, there's a couple of disease states related to antidiuretic hormone. We're not really going to talk about them in this video. I'll do a separate video, but I wanted to mention that you can have too much antidiuretic hormone or you can have not enough antidiuretic hormone. The first instance, too much antidiuretic hormone, can occur in a medical problem called SIADH, or Syndrome of Inappropriate Antidiuretic Hormone Secretion. You can have not enough antidiuretic hormone, and in this case, if you don't have sufficient antidiuretic hormone, you get something called central diabetes insipidus. Now don't be fooled by that word diabetes. This doesn't have anything to do with blood sugar. Diabetes means frequent urination or excessive urination, and we'll talk about the particulars of diabetes insipidus in our next talk. So let's move on now and talk about oxytocin, the second hormone made in the hypothalamus, stored in the posterior pituitary, and released as needed when a nerve impulse from the hypothalamus triggers its release. Oxytocin has 2 effects, well really 3, but the main 2 are uterine contractions and something called milk letdown. Oxytocin stimulates uterine contractions. Although we're not sure exactly what it is that sends a patient into labor, we certainly do know that oxytocin stimulates labor. It stimulates uterine contractions, and women are frequently given Pitocin, which is essentially oxytocin, in labor if their contractions need to be stronger. Pitocin is also added to the patient's IV after delivery to keep the uterus firmly contracted and to prevent excessive postpartum bleeding. The second effect that oxytocin has is on breastfeeding. It's something called milk letdown. And breastfeeding presents a problem. It's a problem of supply and demand. The nursing mom needs to have breast milk ready for the baby when the baby is hungry, but you can't make that much milk on demand. So you have to make the milk and somehow store it and then release it to the baby when the baby needs it. Now, keep in mind, oxytocin does not stimulate the production of milk. That's prolactin. Oxytocin stimulates something called milk letdown. So what is milk letdown? Well, let's look at this next slide. And when the baby sucks on the nipple, a signal is sent to the hypothalamus which triggers the release of oxytocin. Now, in the milk gland, milk is made and it just sits in the gland. It's just stored in the gland. When oxytocin arrives at the milk gland, when it arrives at the mammary gland, the breast, it causes a basket of muscle cells that cradle the milk glands to contract. They squeeze down, and that pushes the milk out into the ducts and makes it available for the baby. The third of the two effects of oxytocin, so to speak, is recent findings that show that oxytocin secretion increases when we spend time with friends and loved ones. It's been called the social hormone, or the bonding hormone. So this concludes our brief survey of posterior pituitary hormones. Let me put up the photo credits, and thank you for your attention.